Great. Well, good morning and thank you for joining us today. I think we have a couple more people that will keep trickling in. We do realize there are at least 3 conflicting meetings at this exact time today. So thank you for spending this lunch hour with us. We really appreciate it. Glad to see you. For those that cannot attend, or if you need to jump off early, we will be recording this meeting and sending out materials as well as meeting notes following up. So more to come. I hope you've all have had a little break from legislative session, maybe have some fun summer plans in order, and that your summers are off to a great start. I did want to note we initially had scheduled this meeting for an hour and a half. We are going to do our very best to get you out of here in an hour today. Have a lot of interesting information to cover, but I think we should be able to get through it pretty quickly. As people continue to trickle in, I think it says in the chat, please go ahead and introduce yourselves, your name, pronouns, and organization. And I did just want to take a moment to introduce the Colorado Health Foundation policy team. For those of you that I haven't had a chance to meet, I'm Alexis Waitman. I'm a senior policy officer here at the foundation, and I think I've had the opportunity to work with many of you in lots of different capacities over the years, but also would like to introduce our newish policy team. I'll hand it over to Emily Rader.
Hello, everyone. My name is Emily Rader. I'm a public policy officer at the foundation. I've been part of the team for about 8 months now, so definitely newer, but excited to be with all of you today for this great discussion. Lauren, I'll pass it over.
Hi, everyone. Good morning. I'm Lauren Morales. I am the newest member of the policy team here at the foundation. I started in January, and I'm a public policy officer. I'll pass it to Austin.
Hi, everyone. My name is Austin Montoya. I am a senior communications officer focused on policy advocacy communications. I also, my main project is our Pulse poll.
Great, thank you. And I don't see Michael yet, but we do have also a new team member on our advocacy implementation team, and that is Michael Smith, and he will be overseeing our advocacy portfolio, and I'm sure many of you will get to meet him as he may be a program officer on some of your grants coming up. So let's go ahead and start sharing the slides. Again, welcome. We are really delighted to have you here for this discussion today to give you an update on an effort we've been working on, gosh, for a couple of years now, which is hard to believe. I think everyone in the Zoom room today is familiar with Health Foundation. We are a statewide private foundation that works to bring health and good reach for all Coloradans with a focus on promoting health equity and racial justice. In addition to our funding, which is perhaps how we're best known, we also do engage in policy and advocacy work within the legal limitations of our tax status. Typically, over the years, our policy engagement has been very much focused on specific issues related to our mission and promoting health equity. However, in 2021, we started an exploration of not just what policies are passed here in Colorado, but how those policies are passed. How do the institutions of state government operate? What are the rules of the game? How do those rules impact who has power, voice, and privilege in those conversations? And really just started a conversation wondering, are there ways we could be doing things differently? So that's why we're here today, to share out a summary of a 3rd round of interviews that we have just completed, and reflect on some of the things that we've been hearing from those conversations. I will note that this is the first audience that we are sharing this information with, so we are really looking to have an interactive conversation with all of you and to hear your input and feedback. We are going to spend some time in presentation mode. We're going to try not to talk at you too long. We will also have some small group discussions in the second half of this, and that's where we really hope to dig in on some reflections and collective sense making. We also are going to use some Zoom polls throughout this conversation just to get some real-time interactions from all of you. So just as we're getting started and to make sure our technology is working, we are going to just do a little icebreaker and introduction Zoom poll to make sure that that is working. hopefully you see a little poll popping up asking about your organization and what you're looking forward to this summer. All right, looks like almost everyone has answered, so we can go ahead and close that. All right, looks like we have a lot of organizations statewide and some focused in Denver. And looks like lots of outdoor enthusiasts looking forward to the summer. So hopefully we'll get through some of this rain and get outside soon. All right. Well, thank you again. And looks like we have a couple more people just trickling in. So go to the next slide, please, Emily. So just a little bit of background on, again, what we've been up to and why we're here today. Because this consideration of the policymaking processes themselves has been a pretty underexplored area for the Health Foundation, we first looked to organizations that are very entrenched in Colorado policymaking to really help us deepen our perspectives on how state government institutions could potentially operate differently to make processes more equitable, inclusive, and racially just. So in late 2021, we had conversations with 25 different advocacy organizations to get their perspectives. We'll acknowledge we did not talk to the entire advocacy universe, but we were really deliberate in seeking out perspectives, especially from organizations led by or centered on BIPOC communities. So that's really who's in this room today. Many of you individually or your organizations were involved in those initial discussions and have really been thought partners to us throughout this process. So thank you for your continued interest and engagement. Those first set of conversations in late 2021 were pretty broad. We looked at state legislative processes, rulemaking, as well as state ballot measures, as well and the judicial system. I will say there was no shortage of information or ideas in any one of those four areas, and we probably could all spend many years looking to redesign and rethink those systems. But based on feedback and conversations with this group, we really decided to dig in more deeply, thinking about operations of the state legislature and operations of administrative rulemaking. So in late 2022, we completed a second round of interviews with, for lack of better terminology, what we're calling legislative insiders, current and former lobbyists, legislators, and legislative staff, and got their perspectives on, again, sort of what's working well and where there are challenges in the state legislative process. And just most recently, we have completed a third round of interviews that dug in much more deeply around rulemaking, and that's what we're here to discuss with you today. We did complete 17 additional interviews with those state agencies, current and former state agency staffers, board members, as well as others who are engaging very intentionally and deliberately with rulemaking bodies. And then the last thing we did want to mention, something just hot off the press, and we're going to share a little bit of this information with you, but in addition to the conversations we've been having with experts, the Health Foundation does conduct an annual poll where we listen to perspectives of Coloradans from around the state. So just in March, I guess April and May of this year, we fielded our annual Pulse poll. And we did ask a couple questions around perceptions of state government and how state government is working for you. So I'm not going to spend a lot of time on the Pulse data, but I did want to share just a little sneak preview. Oh, and Julie, it looks like you have your hand up.
Yeah, when you said boards, that you asked boards on state government, are you talking about like appointed boards, like Human Services Board? Is that what you meant?
Yes, primarily.
Okay.
We did look pretty broadly across, and we interviewed individuals at Human Services, Medical Services, CDPHE. And so we really looked at the broad range, but acknowledged that no two boards are exactly the same, which is part of the challenge. And
no, I just wanted to clarify it was government
yes,
boards, not
yes,
nonprofit board members that were
no,
involved in the process.
Rulemaking bodies. Thank you for that clarification. All right. So again, this is hot off the press, very much in draft format. This information is embargoed, but we did just want to share a tiny bit of information because I think it really frames up the conversation that we're going to have today. So again, on an annual basis, we conduct a survey of Coloradans just to hear what's top of their minds, what are their concerns, what are they thinking about. And this year, we did again have the opportunity to add a couple new questions around their perceptions of state government. So go to the next slide. So from April 8th through May 3rd of this year, we had the poll out in the field. We do work with a bipartisan research team, and we sampled more than 2,600 Coloradans to get their perceptions on state government. All of this information is going to be released shortly, starting in July, but just wanted to share two reflections on some of the two new questions that we asked. So we added one new question this year. Next slide, thank you. On what Coloradans were thinking around having their voice heard in state government and whether or not they consider this to be a challenge or not. So not a surprise, there were a lot of thoughts on the effectiveness of state government. But in terms of what we heard from individuals, there was really a sense that political polarization and lack of compromise between political parties, as well as the strong influence of lobbyists and corporate interests on decision makers, are major challenges in our state. Also a perception that there's a limited understanding among state policymakers about the needs of Coloradans, and a lack of information about how Coloradans can engage in state policymaking processes themselves. So the dark green indicates the percentage that thought this was a major challenge, the lighter green thought it was a minor challenge, and then over on the right of the slide, you can see that upwards of 80% of respondents felt that each of these issues presented a challenge in our state, which is not to spoil the results of the poll to come, but these are pretty staggering rates. And then we also asked a second question on potential actions that could improve policy decisions in state government, and if people thought these would be very effective or somewhat effective. And again, you can see here that pretty strong response rates. Coloradans think that requiring state policymakers to consider the long-term financial impacts of their decisions would be very effective. Making information about how the public can participate and comment on policy decisions would also be really critical. Requiring state policymakers to regularly engage and listen to Coloradans in a meaningful way, as well as considering how decisions will impact different groups of Coloradans. And finally, increasing policymaker access to nonpartisan information and analysis of issues facing Colorado. So again, these are some themes that we heard in our conversations throughout the interviews, but interesting and validating to see that these are also top of mind of many Coloradans from around the state. So Austin, thank you for letting us have a little sneak peek of the pulse data. Hopefully that will entice you to attend some of our briefings coming up a little bit later this summer. So back to where we are today, I think, again, this is a group of individuals and organizations that regularly engage in rulemaking processes. I will say from our conversations, rulemaking is perhaps the most opaque and least understood phase of the policymaking process, and perhaps the most important. So it was interesting to have these conversations and really to learn what people both inside and those from the advocacy community are thinking when it comes to this. So in these 17 additional conversations that we had, they were very much open-ended. We asked respondents to reflect on what works well in Colorado, and I will say there's a lot that does work well in Colorado. I think we're lucky to be working here than in some other states. But then we also explored what are some of the barriers to including community voice and to having transparency in these processes. And then our favorite question was that we gave everyone a magic wand and said, if you could take people, politics, and money out of the equation and redesign the system to really work for people in a more equitable way, what would that look like? So had a lot of fun hearing the visions and dreams of different respondents who we were lucky enough to have conversations with. In these conversations, we looked at the rulemaking board dynamics of who's sitting on those boards, who's appointed to those boards, and who's making those decisions. We looked at the various processes for public engagement, how agency and board staff engage with public in various ways or don't engage with the public. And then also looked at the rulemaking practices and procedures to, again, understand what's working well and where might we be able to shake things up a little bit. So that was the framing for this final round of conversations. The way that we are going to share out information to you today, and I should have said this before, but the first two sets of interviews that we conducted, there are reports on our website that are available. There's a lot of information in there. The third round, we did send out a draft summary of what we learned. So hopefully you have that in your inbox or in your calendar invite to look through as we go through this presentation or afterwards as you reflect on what you're learning. But we thought it was interesting and important to share the different perspectives that we were hearing from different audiences. So as we go through the findings in blue, we will share findings that were specific to those that we're calling rulemaking specialists. So that was this group of interviewees that we just had a chance to connect with. Then we will share perspectives that we heard from advocates as well as those legislative insiders in yellow. And then in green, we will share where there were overlap and perspectives between those two groups. And I will say, not every finding had unique perspectives from each of these groups. So some may only have two bubbles, but that's the framing for this. I am going to now turn it over to my colleague, Lauren, who is going to walk us through what we saw as barriers as well as opportunities. And please, as we're talking, feel free to chat your questions or hold them for the discussion at the end. So thanks, Lauren.
Thank you, Alexis. Just to reintroduce myself, I'm Lauren Morales. I'm the newest public policy officer here at the Foundation, and it's great to be with you this morning. So our goal for the rest of the presentation is to dive into what we heard in the rulemaking interviews and our findings about the challenges and the areas of opportunity that those discussions surfaced. I do want to highlight that although we'll primarily be focusing on areas for improvement in the rulemaking process and what some of those improvements could be, we did also hear positive feedback as well. For example, this included feedback that although they may be imperfect, there are opportunities for engagement in rulemaking, both from the perspective of state agencies and boards proactively reaching out to the public for input and for stakeholders to plug into the process themselves if they're aware of how to engage. We'll start our discussion of our findings with a series of slides on the barriers reported by our rulemaking specialists, or what stands in the way of allowing for an inclusive, equitable rulemaking process. So when it comes to the barriers related to board dynamics specifically, the rulemaking specialists identified a lack of board independence as an issue. They felt like boards do not operate with enough independence from their respective state agencies and those agencies' interests, as well as the interests of the individual board members. In addition, there's a perception that some boards operate in an overtly political manner, which has implications for who's heard and can exert influence during the rulemaking process. Rulemaking specialists also noted the broad scope of many boards and commissions. Because the topics they covered are so wide-ranging, it can be challenging for the public to track issues of interest and for board members to feel equipped to make informed decisions. For both the rulemaking specialists and the advocates and legislative specialists, a shared concern was that there's a lot of inconsistency in practices across the various boards and commissions. More than one individual noted that the statute that provides state agencies direction on how to conduct rulemaking is quite broad, which has resulted in different interpretations on what rulemaking can look like. And that inconsistency has implications, of course, for whose voices are ultimately factored in that decision-making around rulemaking. We'll turn next to the public engagement aspect of the barriers described by the individuals we interviewed. The rulemaking specialists acknowledged that some language support is available for people participating in rulemaking, but services such as interpretation and translation and closed captioning need to be enhanced to provide better accessibility. They also noted some challenges related to boards and state agencies' accountability to public input, which included tokenizing advocates and people with lived experience, and a lack of accountability for state agencies and boards to actually read and take into consideration the input offered during the public comment periods. And communication was also brought up as a barrier, as it can be challenging to find information about boards because their websites and materials are often inaccessible due to their layout and the language that they use. As for the advocates and legislative specialists, they highlighted that boards and their staff are not perceived as generally being representative of the communities impacted by rulemaking, which of course could have implications for whose interests rulemaking ultimately serves. Now, some of the feedback we heard from both the rulemaking specialists and the advocates and legislative specialists centered on stakeholder engagement. Because rulemaking is highly technical and formal and can be such a lengthy process, it can be difficult for the general public and other stakeholders to engage and make their voices heard. And individuals from both groups shared that rulemaking can feel like an inside game, and that cultivating relationships is key to effective engagement, which can be a barrier in particular for members of the public and the smaller grassroots organizations. So now we're going to wrap up our discussion of the barriers highlighted by individuals we spoke with by talking a bit about rulemaking practices specifically. So from the rulemaking specialists, we heard that the state's procurement process results in inequitable outcomes. As you're already aware, potentially, procurement is how the state government seeks out and develops contracts with external organizations and companies for various goods and services. The feedback included the overall bureaucracy of the process and the way that state government pays organizations for their services using a reimbursement model rather than payment upfront, which leads to inequity in who can secure government contracts and grants. These individuals also highlighted that there's not enough communication and collaboration between state and local governments and between the legislative and executive or state agency branches of government, which can have implications for the development and implementation of statewide policies. In addition, it was noted there's a good bit of time and attention and even resources when a bill is in the legislature, but this decreases when it comes time to do rulemaking for that bill, which can result in inadequate funding and support for implementation. And speaking of a lack of resources, rulemaking specialists highlighted that there's not a lot of staff capacity and financial resources dedicated to rulemaking in state and local governments, and even at some advocacy organizations. So it can be hard for advocates, the public, and even government staff to truly track what's happening with rulemaking proceedings. And the last point in this section has to do with a misalignment between vision and execution. And by that, we mean that there can be a big difference in how a program or policy was originally intended to work and how it actually ends up being implemented as a result of the bureaucracy involved at state agencies, such as challenges with procurement and staffing. These antiquated bureaucratic state government systems and practices essentially create a gap between how things were intended to be and how they end up working in reality. On the advocates and legislative specialist side, they noted as a barrier the high volume of rulemaking activity, given the large number of bills that pass at the legislature every year that require rulemaking. They also voiced that there's not enough accountability between branches of government. So for example, the legislature has a limited ability to call into question the implementation of a law that they passed. This group also highlighted a lack of transparency. Some of them described rulemaking as opaque, like Alexis was saying, due to a lack of data and visibility into the process. And finally, we heard from the advocates and legislative specialists that although there is a process by which a person can request a fiscal cost-benefit analysis of proposed rules, there's no process to request a similar analysis regarding the equity impact of the rules. And having such an analysis could yield a fuller picture of what communities are expected to be affected by the implementation of rules and what those effects truly would be. And as you may have noted, this slide is a little bit unusual because there actually was an overlap in the feedback we heard from the rulemaking specialists and the advocates and legislative specialists. And each group had their own unique take on how rulemaking practices can sometimes act as a barrier to participation in the process. So those were the barriers that our interviewees discussed in our conversations with them. And now we're going to focus on what they said about the opportunities that we as a state have to make changes to the rulemaking process to make it more inclusive and equitable. And we'll start by talking about board dynamics. So first, the rulemaking specialists recommended increasing the independence of boards from their associated state agencies, which could help create more equitable and less politicized practices. They also suggested diversifying board membership and noted that board membership should include people with lived experience with a program being regulated, so that experience is factored in when decisions are being made. And related to that point, rulemaking specialists recommended better training for individuals who are serving on boards, particularly those who don't have a background in government, which could allow for greater diversity of board membership. And in addition, supports like childcare and transportation assistance could help make it easier for some people to serve on boards. The feedback we heard from both groups on the topic of board dynamics related to consolidating boards. Because there are so many boards and commissions across state government, it could be much easier to follow issues for the process if some boards were streamlined and consolidated. Okay, continuing our discussion about the opportunities to improve rulemaking, we'll focus next on how public engagement practices can be modified to ensure greater inclusivity and equity in the rulemaking process. The rulemaking specialist had several suggestions for how to improve education and outreach to the public, including conducting trainings for the public on how to engage in rulemaking and creating materials explaining how boards and commissions work. As for the advocates and legislative specialists, they suggested better enforcing public meeting laws and more robust requirements for notifying the public about rulemaking activities. This group also recommended hiring staff dedicated to equity and engagement work related to implementation, and in particular, hiring them from the communities impacted by rulemaking. And enhancing the interpretation and translation services at boards was also suggested so more people can actually access the rulemaking proceedings that impact them and their community. Both the rulemaking specialists and the advocates and legislative specialists thought that boards and state agencies should prioritize intentional outreach to communities affected by rulemaking, and that they should ensure those practices are proactive, make space for reciprocal dialogue, and occur on an ongoing basis. And another idea that was voiced by a number of individuals from both groups was around creating coordinating bodies to support public access. Now, this could take many forms, including the creation of community liaison or ombudsperson roles to provide a consistent avenue of communication between impacted communities and state agencies and boards to help build trust. It could also involve the creation of an Office of Public Participation to provide a centralized contact for the public to better engage in rulemaking. Okay, so we're now on our last set of opportunities, which will focus on rulemaking practices. The rulemaking specialists highlighted state procurement reform as a potentially impactful approach. That reform could consist of minimizing the bureaucracy involved in the process and providing funding upfront to organizations the state contracts with, perhaps through a short-term revolving loan fund. This group also suggested some statute changes. Because the statute governing rulemaking is so broad, it could be beneficial to make some amendments to provide clearer guidance for implementation and associated rulemaking, particularly around how to better engage communities in the process. From the advocates and legislative specialists, we heard a desire to work with the governor's office and state agencies to tackle the issue of government bureaucracy and the ways it can impede equitable rulemaking. They also recommended ensuring that formats and procedures are more consistent from board to board to create a more streamlined and predictable experience for people trying to engage with them, such as more standardized rulemaking related websites and calendars. Both the rulemaking specialists and the advocates and legislative specialists voiced a desire for more co-creation and more feedback loops between legislators and state agencies and between state and local government to enhance communication and accountability. Both groups also made suggestions to increase transparency and accessibility between boards, including creating a centralized portal for accessing all rulemaking information, simplifying the language used, and creating and making available a master calendar of relevant rule-related dates early in the process. Support for nonprofits was also highlighted. We heard that targeted support for nonprofits could allow them to more fully participate in rulemaking. And this could involve a number of things, but including the creation of coalitions to increase grassroots organizations' ability to effectively engage in rulemaking activities. And it was also suggested that the state create a one-stop shop clearinghouse for regulatory expertise and advocacy that could support nonprofits wanting to begin or enhance their work in the rulemaking space to help diversify whose perspectives are being heard in the process. So that is all the feedback we received during our conversations on rulemaking. I hope at least some of that is resonating with you. It's a lot to take in. I see we've gotten a couple of comments. Is there anything that anyone wants to come off mute and discuss, or do we feel like we want to process through a poll right now? I've done a very bad job of monitoring chat. I think we're good though, but I would welcome a conversation later, and we'll have breakout rooms pretty shortly here. So for now, I know, again, that was so much information. We wanted to change gears a little bit. We're going to do a quick poll, another Zoom poll. So our question for you is this: if you had a magic wand, which 2 areas would you address to make rulemaking processes more equitable? We'll give you a little bit of time to think about that and weigh in.
And just a comment, we're not holding you to this. This is just a quick temperature check. There's no right or wrong answer, but just curious to see where there may be some energy. And again, we're gonna head into some breakout discussion rooms too.
Give it a couple more seconds. So far, we have a very popular one, the community outreach. I think I'm seeing less changing in the poll outcomes. So let's close the poll. So it looks like the top recommendation is to improve community outreach. We heard that a lot from the various people we talked to in this process. And it looks like the second most commonly selected magic wand suggestion is to diversify membership of boards, which also makes a whole lot of sense and rings true with what we've heard. So thank you everyone for participating in that poll. So now we're going to transition again into some breakout rooms to allow for more conversation about everything we just presented to you. Emily is going to drop in the chat some questions that we'll be discussing in these breakout rooms, and Austin will be assigning everyone into rooms. And we'll have about 15 minutes to delve into the topics that we just covered today and that you all have just heard about. I hope you all have a great discussion, and we'll see you back here in about 15 minutes.
Sorry, Lauren. Yeah, I'd be happy to share an example.
That would be wonderful. Thank you so much, Bethany. I appreciate it. I guess we're the overachievers. We're here on time. I will say, if there's anything that you 3 think of after this conversation, certainly shoot me an email. I think Alexis will probably say something to that effect, but if anything comes up, please don't hesitate to reach out.
Hi, everyone. Welcome back. Hope, sorry, we got sucked back into the virtual big room right in the middle of your good thought, but hope everyone had a good discussion. I feel like my group was just getting started. We probably could have used another hour to continue unpacking some very large, very meaty issues. I don't know, our group didn't quite get to it, but I would love to just hear if anyone's willing to share what reflections your group was having, what ideas you had, what was resonating. Would love to just open it up, and you know, if you have one or two things that you'd love to put into the space, love to hear them.
I think this is Tawana for our group. Rich conversation and very helpful conversation for Soul to Soul Sisters and having this learning opportunity. But the one thing that really hit home for me was when Adam was talking about in the rulemaking process, making it more accessible. And that is something that I look forward to connecting our Black civic engagement and policy person and myself with Adam to talk more about that and how how can we make that space more accessible? And how can we build capacity to then, take advantage of that accessibility? Because capacity was another challenge that we talked about as well.
Great, thank you so much for sharing that. Others? I'll say our group also, I was with Melanie, Julie, Alexandra, and Hope, also talking a lot about accessibility in a variety of ways, but certainly language accessibility and just making these boards more relevant and truly welcoming, and not just legal jargon saying that we can provide translation services, but making that really core. I don't know, Julie, I don't want to put you on the spot, but I think we had a lot of expertise navigating these rulemaking bodies in our group, and just the continued lack of transparency, ability to find information. We also talked a lot about just who is appointed to those boards and commissions, and what that process looks like, and are there ways to have a lineup of ready to go board members waiting in the wings to get on those boards and commissions in a way that maybe is a little more transparent and less political than current.
Yeah, I think we were, I was saying that my dream would be that the advocacy community could get together and we could kind of like share our bench of people, so that, because it's always like, well, we need a Democrat from CD4, who knows X. And so it's hard to like get the right people in the right place when we all have our like little specialty areas, and some people are like regional or local. But and then I was being kind of sarcastic, but kind of not, when Alexis asked, would we want to see a standardization, like that they all operated the same way? And I said, well, only if it was the way I thought it should be, but because we don't want to take the bad boards and, like some of the boards are horrible and some do much better. So like if we had some control as an advocacy community, I think we all could agree on what we like, like not having to sign up in advance, responses back, a reasonable amount of time to review things, some plain language, all of that. But like I would be like a little nervous about just saying it should all be standardized, because I think the state could do bad things with that. I do have to say, I put this in the chat, I was heartened by the comments of the rulemaking staff that I saw. I thought that there was some real thoughtfulness and stuff like that. They saw a lot of the problems, and I guess maybe didn't give enough credit, because I was surprised by that, and pleasantly. I don't know if other people, like, I guess I thought they would have been defensive and like said like, oh, the process works great, and I was pleased. So
I think, sort of building off of that comment, Julie, I think one of the, I think we've encountered a number of scenarios where we're advocating for sort of more inclusive board processes and regulatory processes and things like that. And we're making some progress, but there are sort of those internal limitations of the staff and the capacity at those entities to actually be able to do more to be inclusive. And like, for instance, there's not really a line item in the state budget for translation and interpretation services. Like, it doesn't exist in the state budget, much less the individual department budgets. So how do we sort of overcome some of those fiscal financial constraints and frankly, state budget and TABOR constraints that are sort of strangling some of the potential opportunities?
Thanks for that comment, Adam. Bethany.
This is kind of a very big picture comment, is that one of the reasons that rulemaking is so daunting and is so overly complicated is because as a society, we have chosen to make safety net benefits, things that benefit, people with less money, fewer resources, super complicated. That's like a societal choice. And that does, pour into rulemaking. And it makes it very hard to wade through. So I think there's like a really overall goal: simplify, make it, easy to access the things you need, instead of setting up a million different requirements for everything as part of it. So I think there's some underlying like base issues there.
Point. Other reflections, ideas, things that you would want to wave your magic wand at?
I think for me, I agree with everything everybody said. Melanie hit it at boards. I've been in policy work and advocacy work for a long time. For me, it's the most misunderstood, lack of transparent sector. And I don't know if we can do anything about that. I mean, Julie had some great ideas. She's done a lot of work in it. And I have really never even applied for a board because I'm such a strong activist. I don't know that I would ever get appointed. And so, thinking through that, I mean, not only safe people can be on these boards, we need activists, we need people who are going to speak up, but I think it's just a very complicated sector of the policy advocacy space that, thank you for bringing some light on it, because there was so many things I didn't even know, and I've been doing this work for a very long time. So thank you, but it is, I don't understand it at all. Like, it's just, I'm in the dark about it all. So I think shedding a little bit of light has been, a lot of things went off in my head. So thanks.
I'd say if Melanie's in the dark about anything, we have a problem. So thanks for sharing that.
Alexis.
Other thoughts? I want to give this space. Here's some great ideas. All right, I think I gave that I don't know if that was 17 seconds. We're supposed to sit in awkward silence before we move on, but thank you all for these this rich discussion. I will say there is a lot of information here. This is one set of 3 sets of information that we have collected. Our team is going to definitely be wanting to reach out to many of you to continue processing through what are some of the things that we want to collectively move forward. I think we've heard some great ideas today. I mentioned at the beginning, we have already done just some simple fact sheets that we have shared with legislative leadership on some of the things that we learned and heard from the legislative interviews on some just sort of, here's some quick process changes and fixes. Maybe they're not easy, but things that you could do next legislative session. That has been pretty well received. We plan to do more of that. And then as we were alluding to, I think we really are looking for 1 or 2 big things that we may want to move forward in partnership with many of you and broaden the coalition and really think about how can we make Colorado's policymaking processes more equitable. But obviously there are no shortage of ideas here, and we'll need some additional assistance continuing to prioritize and think through how we should best move forward. So feel free to reach out to me or any member of the policy team as more ideas come to mind. But this I really see as the beginning of a longer term conversation that we hope to continue with many of you in the months ahead. Just a couple other things I wanted to mention about ways that we hope to continue engaging with all of you. As I mentioned, the Pulse poll is going to be released this summer, and would love to have you all participate in that conversation. That is going to be a phased release starting in July. We're going to do a couple different sessions, one around affordable housing, a deep dive on critical themes in August, and then really a deep dive on responses from the Hispanic and Latino community. So those are tentative dates. Don't hold us to those. We think they're getting close to final. Those might shift a little bit, but we will be sending out registration details soon. Late in July, we have our annual Colorado Health Symposium up in Keystone, and we hope to see many of you there. We do plan to share out a summary of what we've been learning through these various conversations there, and also do some crowdsourcing of ideas. And for those of you that will be there, I would love to continue this conversation with many of you. And finally, sometime this fall, we haven't set a date yet, but we would like to have a broader convening and conversation with other partners. Again, this has been kind of a small group of thought partners that we have been looking to, but want to widen that table, invite others into the conversation, and again, continue to think through what are some of the opportunities that we have. So thank you for your continued engagement. We do have one final poll that we would love to just get your thoughts on how and if you want to continue to be engaged in this conversation, as well as if you are interested in engaging in Pulse. And Austin's already put his information in there. In addition to the formal briefings, we're also happy to do deeper dives and conversations with any of you on issues that you care about. All right. Looks like we are at a critical mass of responses. Looks like we will continue to be in touch with almost all of you in some shape or form. So thank you again for your time today. We hope you have a great rest of your afternoon. Got you out of here not quite in an hour, but an hour and 6 minutes. So thanks for your continued conversation, and we will be following up with materials and other information. Harry, did I see you come off mute?
I was just going to say thank you all. It's been great.
Oh, well, thank you again. Great to see all of you. Enjoy the rest of your Tuesday. Take care.